We're back with Dan, Texas Panhandle Centers. Sheldon, there's so much work that Texas Panhandle Centers does, a wide variety. Dan, I'm glad that you came. And I didn't realize that September is suicide awareness. Yes, but tell me a little bit, because I feel like suicide is not talked about. And I get it, but I just feel like that things have changed, and we really have to talk about it. And we have to, there's signs. I've had people close to me that things have happened to, and I'm like, I did not see that. I did not realize. Yeah. So glad you're here. Help us with this.
Well, thank you so much for having us. And you're completely right. You know, this is something that needs to be talked about. It's something that needs to be discussed. You know, suicide and mental health, and you know, unfortunately, there's such a stigma that's associated with seeking help for mental health issues, and really today, if we could just have one takeaway, probably one of the most important things that we could talk about would be how important it is to remove the stigma associated with someone reaching out and asking for the help that they need. Because at the end of the day, mental health is health, right? Mental health it's health just as much as physical health is. And when you look at the numbers and you look at the statistics when it comes to mental health, in 2023, 1 in 5 Americans had been diagnosed with a mental illness. In Texas that same year, 1 in 4 Texans stated that their mental health was not good for 5 days in the previous month when they were asked. And so this is not something that, you know, is just a small segment of the population. Mental health is something that affects a very large portion of Americans. And again, it's so important that we remove that stigma associated with folks that are seeking help. Truthfully and honestly, there should be no stigma. It should be the same. If I'm going to go get help for a mental illness, it should be the same as if I'm going to get help for my heart or for another physical health issue. And so very important that we're having this conversation today.
Yes, absolutely. And so kind of talk about that a little bit, because that's the thing, is there's services available out there. And what I think is what's so cool about Texas Panhandle Centers, it's just that it's not Amarillo Centers, it's Texas Panhandle Centers. I mean, you serve not just here in town, but you're really, you know, like I said, you know, branching out across the whole Panhandle to provide these services all over. So kind of give folks a little bit of an idea of the ways that they can reach out and what they can expect if they were to reach you. Yeah,
absolutely. So Texas Panhandle Centers, you nailed it on the head. This is not just something for Amarillo. We serve the upper 21 counties of the Texas Panhandle. And so we have offices here in Amarillo, and we also have offices in Borger, Clarendon, Dumas, Hereford, Perryton, Pampa, and so we serve the upper 21 counties of the Texas Panhandle. We are a certified community behavioral health clinic, and we're a local nonprofit organization. We serve more than 10,000 people every year with behavioral and developmental needs, and so, you know, our statement, our what we want to do is we want to make lives better, and that's our mission, that's our goal. And so one of the big things, whenever you begin to look at mental health, and specifically people that did not seek out treatment, one of the biggest reasons that folks that needed help did not seek out treatment was because they felt that they couldn't afford it. And so just sort of to mention for Texas Panhandle Centers, money is never a fun thing to talk about, but Texas Panhandle Centers, we operate off of a sliding scale. And so we base our services and the cost of those services based on income. And so the majority of the folks that we serve, they don't have to pay a penny for the services that they receive. And the biggest thing that I want to mention and say today is that if somebody's out there and they're saying, I need help, but I can't afford it, we're here to help. And don't allow an inability to afford those services to keep you from reaching out to the help that you need.
Oh, I'm so glad you said it. What is the best way to get a hold of y'all? Everything's online, but y'all have a phone number.
We absolutely do.
I'm writing it down. Tell me.
So there's 2 ways that I'll mention it. Okay. So number one is I'll mention if a person is dealing with a mental health crisis, maybe they're having thoughts of suicide. The number to call is 988.
988.
988.
Okay.
It's just like 911. You dial 988, and it is our suicide and crisis lifeline. Okay. And it operates 24 hours a day, 7 days a week. You can call, you can get connected with a qualified mental health professional who will talk with you, and they can connect you with services. At TPC, we have what's known as an MCOT team, a mobile crisis outreach team, and so if a person is really experiencing a crisis where they need help right now, our teams can be activated and they can meet the people in the communities where they need it, when they need it, to get the help that they need. So if somebody is experiencing that crisis and they need help right away, they can call 988. The other way to get in touch with us, maybe somebody's like, I'm not experiencing crisis, but I do want help.
Yes.
They can give us a call at 806.
Okay, 806
337
337
1000.
1000. That's pretty easy to remember.
Yeah.
Please call. Please call. Please don't let that, just like you said, I don't have the money. I don't know what people are going to think. How are they going to listen to me? Don't.
Yeah.
Just call. Just make that. And TPC, can we find you online too?
Yep, our website is www.texaspanhandlecenters.org.
Okay.
And you can find us on there. You can get information about all the services that we offer. We offer a wide array of services, everything from psychiatric and nursing services to case management, peer support. We have a veterans program. We have substance use treatment programs and a lot of specialized programs. So we're here to help, and we have a lot of resources available to help the folks that need it.
Yay!
Yes.
Yay! I want everyone to know. Dan,
Yes.
thank you for coming.
Well,
Thank you. I hope that we can catch back up with you and talk. And I'm just so glad. 21 counties.
Yes, ma'am.
We need you.
Yes, ma'am.
We need you. Thank
Yes,
you.
ma'am. Thank you so much. Thank
Yes.
you all for having me.
Of course, yes. And we